Hey, folks, this is the show where we want to naturally get you well and keep you well. I want to give you the information that you need to take control of your own health. It is a scary time right now in healthcare. Well, sick care. I don't want to call it healthcare, it's sick care. And the thing that gets me is people keep talking about the health insurance crisis and the health bills and the Obama cares and the Trump cares, and all that's well and good, but nobody is talking about healthcare. Everybody's talking about insurance. Think about that. We're not talking about the health care, the actual care you get from the doctor. We're talking about who's going to pay for it, how much is going to get paid, and the numbers are scary. The numbers in medical school, chiropractic school, dental school, as far as I know, are dropping. New students. Nobody wants to do it anymore. It's too much work. In fact, I was talking to one of my coworkers here before I went on the air, and she said that her doctor, as soon as the Obamacare started coming in, just closed her practice. She goes, she was a couple of years away from retirement. She goes, I'm just going to do it. I don't want to deal with all this. And as a practice, I run 3 practices, I totally get that. We spend more money and more time dealing with the BS that goes on with filling out insurance claims and denials and paperwork and getting our doctors credentialed. We already have licenses. We already pass all the tests we need. And then we have to get re-credentialed through each individual insurance company. And each one has different requirements. So it really is insane what's going on. So you are seeing a lot of doctors dropping out of practice, and you, the patient, are going to suffer. So one part of healthcare is actually booming. You know what it is? What's called alternative healthcare. What I do. And so for all the years, we were the redheaded stepchild. We were beat up and kicked and thrown aside, and you're just chiropractors, you're just nutritionists, you're just I don't do acupuncture. Acupuncturists or yoga instructors, meditation. All that was poo-pooed for decades, and now suddenly that's the field that's taking over. So perhaps this is all a good thing that's happening. People in the United States spend around $30 billion each year on what they call alternative healthcare. I'm using that term. I feel it should be primary health care, but I'm going to use it because that's the one that's accepted in the media. Now, $30 billion is a lot of money, but what's more amazing is that one has to wonder why America is spending that much money on what one prominent drug company once called eclectic or unconventional health approaches instead of mainstream medicine. According to a Time article covering the National Health Statistics Report, complementary health approaches are alternative types of healing outside the realm of Western medicine, and they're fairly popular in the U.S. Well, guess what, folks? They're really popular everywhere else in the world. We are so far behind when it comes to actually administering health care. Complementary medical approaches are alternative types of healing outside the realm. An estimated 60 million Americans spend money on them each year, and 4.1 million children have used some type of complementary medicine, the report reveals. In all, the out-of-pocket costs for these types of therapies total $30.2 billion. It's a lot of money you folks are spending on folks like me. Not all with me. Unfortunately, it's not all with me. So what does it all mean? Homeopathy, chiropractic, supplements, yoga, naturopathy, Ayurveda, which is the study of food as medicine from India, special diets, hypnosis, acupuncture, chelation, massage, and energy healing. $30 billion being spent on this alternative healthcare. Well, guess what? That's only about 1%, a mere fraction of what we're spending every year on conventional or ordinary healthcare. So we're spending a lot of money, and that's why there's so much buzz about healthcare in the news and reforming healthcare and changing healthcare. Nobody's reforming healthcare. We're reforming the insurance companies. I don't know if we need to do that or not. They stink now. I don't think they're going to get better. It worked fine. Years ago, you paid a premium, you paid a deductible, small deductible, the insurance company paid, you paid your copay, and everything went on. Why that had to change, I don't know. I still can't figure out for the life of me why that all happened. Now, yeah, well, we want to get people coverage who don't have coverage, but you know what? If somebody has a $5,000 deductible, in my eyes, they don't have coverage anyway. But the one place that's growing is alternative healthcare, which makes me really excited. $14.7 billion spent on things like yoga and chiropractors. I found it interesting. They put yoga and chiropractors in the same group. But $14.7 on that. $12 billion on supplements, $2.7 billion on CDs, books, self-help materials, and other topics. Now, the good news is, as a chiropractor, I fit into the first group. I fit into the second group of supplements because I have my own line of supplements, and I have my own books and CDs. So I guess I was way ahead of the curve, and I was cool before it was cool. Wish that I could be like the cool kids. Well, I was being cool, and I didn't even realize it. Because we've been doing alternative healthcare now for over 30 years, 32 plus years. So it's kind of neat that that world is finally catching up to what I knew and what a lot of us knew, 30, 40 years ago. The big problem that we start to see is that, one author, Richard Nahan, PhD from the U.S. National Center for Complementary and Integrative Health, said the amount of money spent in the U.S. by people who disregard their lack of health care insurance coverage, they realize whether you have coverage or not, you don't have coverage with a $6,000 deductible. They're spending money on things that work. And that's the bottom line. People have $1. Where are they going to spend it? They're spending it on things that get great results. Now, I am not against medicine. I'm not against drugs. I'm not against surgery. A couple of weeks ago, I had a fellow call me up, an internal medicine doctor. And he said, Dr. Joe, I want to meet with you. I said, okay. So we went out to lunch. Really nice guy. Really liked him a lot. And he basically said, I want to practice with you. And I said, wow, really? He says, I want to learn what you know. This is the trend in healthcare. He says, I'm a 40-year-old medical doctor. He says, I see that people are frustrated with medicine. The doctors are frustrated with medicine. The pharmacists are frustrated with medicine. And people are not getting the results that they're getting, in many cases, not all, but many cases, under alternative healthcare. And I love that approach because I co-manage a lot of cases. What I mean by co-manage is you're seeing your medical doctor, you're seeing your oncologist, you're seeing your orthopedist, your neurologist, your pain management doctor, and you're seeing us. And we manage the case together. And I'll tell people, too, listen, if I get you on supplements, you might not need some of your medication. So we have to monitor the medication really closely so that we don't give you too much. And so I said, make sure we're in touch with the medical doctor and tell him, listen, doc, I'm on blood thinners, but I'm taking Dr. Joe's Super Greens and Dr. Joe's Essential Source, which have vitamin K in it, so I have to monitor my blood thinner medication. Not a problem. We just monitor it and say, okay, this is how we have to adjust your medicine. Ultimately, my goal is to get you well enough that you don't need the medicine. However, I'm not saying come off the medicine. I'm saying let's work together to see what we can do to get you well. A lot of people have acid reflux and heartburn. How many people have that? Raise your hands. Okay, a lot of people then are on acid reflux medication. Sometimes you need it. I'm not against that. However, if you read the fine print, you'll find out that it can prevent you from absorbing calcium, B12, iron, and magnesium. Oh, I didn't read the fine print, Dr. Joe. I know. Now suddenly you're having muscle cramps. And now you're on painkillers and muscle relaxers because you don't have enough magnesium because you're not absorbing it because you're taking the medication. You're suddenly anemic. You're taking iron supplements or iron prescriptions. Why? Because you're not absorbing your iron. Ladies might start, or men might start to develop osteoporosis, and they put you on medications for that, but you're not absorbing your calcium because you're taking the acid reflux medication. And, I'm going to get here, follow me on this, you might be on blood pressure medication. If the stomach is pushed up against the diaphragm, you might have acid reflux, heartburn, burping, gas, bloating, chronic cough, chronic sinus problems. But one of the same nerves that controls the stomach controls the heart. It's called the vagus nerve, V-A-G-U-S. And if the vagus nerve is being irritated because you have acid reflux or hiatal hernia, it can be sending a message over to the heart, causing the heart to beat irregularly, erratically, and harder, raising your blood pressure. And a lot of patients over the years, when we massage or adjust their stomach down away from the diaphragm, now they're absorbing their nutrients better. They don't need the acid reflux medication. So that can hopefully get them off other medications and many times get them off their blood pressure medication or their atrial fibrillation because the heart now starts to beat normally. Once again, I'm not telling you to come off your medication. Please, I'm telling you, let's work with your other doctors to see if there's ways to get the body healthy so you don't need the medication. And that's why so many doctors love this radio show. Hospitals. I had one of the major learning hospitals in my town ask me if I would teach endocrinology. And I jokingly said, but I'm a backcracker. You really want a backcracker teaching it? And they said, no, we want you to teach the doctors as well as the students because we talk about you constantly. in the hospital. We talk about your show constantly because we never looked at it the way you discuss it. And I said, cool. Life University, Chiropractic College, where I went to school, have asked me to teach nutrition. And they said, we really want a chiropractor who understands nutrition teaching the students. And I just don't have time. I'd love to. I'm honored and flattered that these major universities would ask me to teach, but I just don't have the time. I'm busy with my practices. I'm busy seeing patients. So the trend is definitely going toward this realm. And so for 32 years of practice, I battled through the tough times, and now it's becoming what I would consider the good times. Because when it comes to neck pain, back pain, shoulder pain, numbness, tingling, a lot of doctors refer to us to say, Doc, see if it's a pinched nerve, see if you can fix it before we go further with shots or surgeries. And when it comes to nutrition, which is, I have 5 degrees. I'm board certified in chiropractic, orthopedics, pain management, and double board certified in nutrition. When it comes to nutrition, a lot of people are sending their patients to us as well, saying, Doc, we got to start eating right. That's why I created Dr. Joe's Super Greens and Dr. Joe's Essential Source. I have several other supplements I created too. Some other ones, in fact, we're reformulating the cold and flu tonic and immune booster. But an intestinal cleanser, Dr. Joe's intestinal cleanser to keep your bowels moving. We have the Dr. Joe's Super Greens and Essential Source, which I take every single day. I have them sitting in front of me right here. It's the minimum amount of nutrients that you need for a day. And it's a scoop, 2 scoops of powder, 1 scoop each, and I mix it with coconut milk, ramen milk. I put it in a glass jar, shake it up, and drink it every day, at least once a day. And it's amazing. People look at me and say, gosh, you look 20 years younger than you are. You have no wrinkles. You have no gray hair. Yeah, my energy level is off the chart because I give the body the nutrients that it needs. And a big part of that is Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're available on my website, drjoeesposito.com. So we want to make sure that you're getting at least the minimum amount of nutrients. From a chiropractic standpoint, it just makes sense. If you have a pinched nerve, unpinch it. And when you put the bones back in place and unpinch it, not only does it help with pain, but those nerves also control organs. So it opens up the nerve supply to the organs, and the organs are able to work more efficiently as well. So this is why things like chiropractic and alternative healthcare are just booming, and why people travel from states and countries. In my office, we've had patients from Japan, Italy, Germany, Romania come see it because the show is heard all around the world. And people say, wow, this is the type of treatment I want. We had one guy get mad at me from Romania. He was emailing me, and he wanted me to come to Romania and teach. And I said, I don't have time. I can't even teach in the States. And he got a little mean with me. Well, this is not fair. You have this knowledge, and you're not sharing it with the doctors in Romania. Now people are suffering. I can't be everywhere. Have them listen to my radio shows. And a lot of doctors do. They play the show in their offices because this is what they want their patients to hear. And by the way, I archive these shows on my website, drjoeesposito.com, and they're all no charge. You can listen to as many as you want, as often as you want, my gift. I also videotape my live lectures. And check my schedules and see if I'm lecturing near you. Come out to my live lectures. They're a blast. And I videotape those and put them on my website as well. And I've had teachers play my videos in their classrooms. So it's kind of neat. But anyway, back to you. So part of the reason alternative healthcare is expanding is because of the soaring costs associated with conventional medicine, and chronic pain is often a motivation to people. They want to get off their medication because they can't afford it, or they're just sick of it and they want to get well. So you could say that money spent indicates the most dramatic way possible that people either trust alternative healthcare practitioners or are working them in as part of their treatment plan. Journal of the American Medical Association published a neat article revealing that following heart disease and cancer, ready for this? American healthcare system is the 3rd highest cause of preventable disease in the United States. And this is according to the Commonwealth Fund. Despite the most expensive healthcare system, this is a quote from the article, the United States ranks last overall among 11 industrialized nations that measures on measures of health system quality, effectiveness, access to care, equality, and healthy lives. So we spend more money per person than anyone else, and yet we're one of the worst. Now, there's a lot of room for improvement. U.S. stands out for having the highest cost and the lowest performance. We, the U.S., spend $8,508 per person on health care a year, compared to $3,406 in the United Kingdom, which ranked first overall. So what is that? That's, somewhere between a half and a third more. that we're spending, and yet we're still ranked dead last or near last in a lot of areas. So what are we doing wrong? What I think we're doing wrong is a lot of other countries, say recognize, but utilize maybe is the right word, what's considered alternative health care a lot more effectively. Herbs, supplements, homeopathy, massage, chiropractic care is big in the United States. It's big all over the world too. So you're seeing that the U.S. has some catch up to do, and we're getting there. And that's the cool part. And a lot of it has to do with people like you who are saying, I want something different. I don't want to just throw away all my medicine or my surgery. You need that. But what else can I do? And that's why super greens are so popular. Gosh, we send super greens an essential source all over the world because people want that. Follow me on Facebook, too, by the way. It's Facebook.com/Dr. Joe Esposito. Follow me on Instagram. We send out a lot of good information because we have followers from all over the world as well. And we send out some good information there as well. So iatrogenic disease, which by definition means caused by the doctor or the hospital, is some of the worst ways to get sick. The Journal of the American Medical Association article indicated that fatal events from iatrogenic causes, for example, due to physician or hospital's activity, manner, or therapy, are responsible for the deaths of 210,000 Americans annually. So that's 800 people a day, somewhere in there maybe. 8 times 3 is 24. 700 people a day, if I did the math right? 7 times 365, yeah. Including deaths related to diagnostic errors, errors of omissions, and failure to follow guidelines. When you add those in, it skyrockets to 440 preventable hospital deaths each year. So you do 365, that's about 1,500 people a day dying from preventable diseases. According to several research studies, in the last decade, a total of 225,000 Americans per year have died as a result of medical treatments. It's a lot of folks. So, folks, if you'd like to come see us, and again, I'm not knocking my medical counterparts, we're working together on this, we would love to have the opportunity to take you on as a patient. We have offices in Marietta, Duluth, and Stockbridge. So go to my website, drjoeesposito.com, or just Google Dr. Joe with the number one Dr. Joe in the world, and we will set you up a time to come see us. We accept people with all insurances. We accept people without insurances, car accidents, sports injuries, workers' comp, Medicare. Yeah, we still accept Medicare. We want to be your doctors. We would like the opportunity to work on your nervous system, your digestive system, and your diet. So if you're sick and tired of being sick and tired and you're ready to get well, go to my website, drjoeesposito.com, and you can make an appointment. My website, drjoeesposito.com, we archive these shows, and we have a lot of articles that I've written. We have access to my supplements, Dr. Joe's Super Greens, Dr. Joe's Essential Source, so you can access that as well. Videos of my lectures, and if you have questions, you can send them to me through the website as well. I'm more than happy to answer your questions for you. So today we're talking about why alternative healthcare is booming. And let me see, according to this study from the Journal of the American Medical Association, 12,000 deaths per year due to unnecessary surgery, 7,000 due to medication errors in the hospital, 20,000 due to other errors in the hospital, 80,000 due to infections in the hospitals, and 106,000 deaths per year due to negative effects of drugs. I am not against drugs. I'll say that 1,000 times. But there are alternatives that might work better in some cases. Now, these numbers at the time made iatrogenic disease the third leading cause of death behind heart disease and cancer. CNN reported the leading cause of unintentional death the previous year was from drug overdoses, 14% increase since the year before. Overall, opioid drug overdoses have doubled. They've doubled twice. Now, that's big news right now, opioid medication. What the heck is an opioid? You don't know. Most people don't. I wish they'd report this. Opioids get into the brain, and they effectively make you feel good, and they cover up pain. So there are times when patients are in pain. I have to get them prescribed. I don't prescribe. I send them out to my medical colleagues to prescribe medications. And some people are more likely to get addicted than others. So they might start taking these opioids, and when they start coming off the opioids, their body isn't producing their own natural opioids. So now you're coming off the opioids, you're not producing your own, and the pain is excruciating. And so people now get addicted to the opioids. And it's scary stuff because now they're making synthetic opioids, selling them on the black market. People are dying from it. So instead of addressing the opioid crisis, or in addition to addressing the opioid crisis, I feel we need to address why people get on the opioids to begin with. Now, some of them do it for recreation. I get that. But a lot of people are innocent addicts. Accidental addicts, maybe is the right word. They don't mean to become an addict. They take it because they're in so much pain. But nobody's talking about addressing the cause of the pain. As a chiropractor, we deal with pain patients all day, every day. Neck pain, back pain, shoulder pain, numbness, tingling, muscle weakness. But if you're pinching a nerve, 10% of the nerves feel pain, 90% of the nerves don't feel pain. So you can have a pinched nerve 90% of the time, in theory, and not know it. And that can affect the organs. So as a chiropractor, I've adjusted, millions of bones in my career. And people will say, well, doc, you adjusted me and my bowels started working. My sex organs started working. My asthma went away. My heart rate regulated. My diabetes seemed to improve. Every organ in the body has nerves that go to it. So if you pinch a nerve, not only might it cause pain 10% of the time, but 90% of the time it could affect the function of the organ that's on the other end of the nerve. So this is why I feel we need to get to the cause of the problem as well as addressing the problem itself. Now suddenly we have a plan. Up to this point, we can say, oh my gosh, opioids are terrible, don't take them, be careful, the black market ones are dangerous. Nobody's saying, why are people taking to begin with? And now we are. Finally, there's a voice of reason when it comes to healthcare. That's this show. And that's why I appreciate you listening, because it really is the voice of reason. My goal is to get you well and keep you well. Normally functioning nervous system, normally functioning digestive system, and good nutrition have to be part of a healthcare plan. I don't care you're Democrat, Republican, Independent. I don't care what belief you have or philosophical background you have to address the cause. Normally functioning nervous system, normally functioning digestive system, good nutrition. The biggest increase of deaths from synthetic opioids, which went up 80%, and that's coming from the fake synthetic ones. According to the CDC, an increase in synthetic opioid deaths coincides with the increase of reports by law enforcement of illicitly manufactured fentanyl, which now we're making the fake stuff. People are making it in their living room, so to speak. Prescription painkillers such as oxycodone and morphine are derived from the same poppy plants as heroin. Big statement. Most heroin users initially start by using prescription painkillers. Pretty cool. So why not get to the cause of the problem and not just treat the symptom, and then we won't have to worry about it. Here we are, we're going to the end game, but we're not going upstream where the problem's coming from. If there's any information that might reveal the U.S. healthcare system is deeply flawed or even dangerous, it's this. A growing number of healthcare workers, including doctors and nurses, are seeking alternative healthcare options for themselves, their family, and their friends, as opposed to taking the conventional route. I see this in my offices all day, every day. Nurses, I always say nurses make the best patients, and nurses and doctors make the best patients because they do what you tell them. Engineers make the second best patients because they understand that structure affects function. And as a chiropractor, if there's pinched nerves, misalignments, muscle spasms, you've got to realign it in order to make it work. So nurses, doctors, number one, engineers, number two. The other patients, I have to almost convince them that they need the care. Those two groups get it. And they go, yep, you're absolutely right. I'll do whatever you say. And treatment in my offices is not long. I think our average is 60 days of treatment. And then after that, we put a maintenance program together. But active treatment, usually about 60 days. So why are you suffering needlessly? I don't know that. And if we just want to do nutrition, we could do just nutrition. But I find when you get the nervous system, the digestive system, and the diet working together, that's when you have a good healthcare plan. So, folks, if you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge. My website, drjoeesposito.com, or just Google Dr. Joe with the number one Dr. Joe in the world, and we are more than happy to set you up an appointment for you, your friends, and family. But here's the deal. If you're not ready to make some changes, don't make an appointment. I want people who are serious about wanting to get well, you, your friends, your family, and your children. We accept people with all insurances, no insurance, car accidents, sports injuries. I'll say it 1,000 times. I've never seen a car accident where the car was damaged and the occupants weren't. So if you're ready to get well, my website, drjoeesposito.com, or just Google Dr. Joe. You can also order my supplements there, my books. If you have questions, send them to me through the website. We want to be your doctors. Give us that opportunity, and most people are very happy with that decision. Hey, don't go anywhere. Tell your friends about the show. We'll be right back. This is the show where we naturally get you well and keep you well. Thanks for joining us, folks. I'm Dr. Joe Esposito, and we're talking today about answering the question why healthcare and alternative healthcare is booming when all the other areas of healthcare are really having challenges. And there's a lot of reasons behind that. Number one is insurance, which in a weird way is great because for years, people like chiropractors, acupuncturists, massage therapists, they weren't covered by insurance. If they were covered at much less. And Obama promised us when Obamacare came in that all doctors would be treated equally. Now, I don't care if you're Republican or Democrat, this was a lie because it still didn't give equality to alternative healthcare practitioners. And it was very frustrating because people said, okay, well, if you're going to do this Obamacare thing, and I know that I'm going to get the same coverage with my chiropractor that I will my medical doctor, with my internist, my orthopedist, it didn't happen. And so for years, chiropractors and alternative healthcare practitioners were the redheaded stepchild. And now everybody's a redheaded stepchild. And I see so many doctors dropping out of practice, all professions, I don't care what it is. And I joked that when we got together, we used to talk about girls and sports, and now we talk about what's your exit strategy? How are you going to retire? You think a hospital is going to buy out your practice? I mean, that's what we talk about. That's all we talk about because we're not being able to be doctors anymore. We have to be technicians. We have to be administrators. We have to be secretarial administrators because we have to do all the paperwork. And so being a doctor really has become a thing of the past. And so I want to tell you why alternative healthcare is booming and how you can become part of it, which is really easy. And a lot of it is you do it yourself. It doesn't even cost you anything. And one of the trends I'm seeing is that more and more conventional practitioners, nurses, medical doctors, are turning for their own treatment to alternative healthcares. Conventional doctors are also referring a lot more of their patients that are experiencing chronic pain and debilitating diseases to holistic doctors and chiropractic care, something that was unheard of even 10 years ago. 20 years ago, certainly, or 30 years ago was never heard of. But I have doctors every day call me up, not every day, but almost every day, call me up with questions, call me up with, hey, I got this patient I want you to see. Attorneys refer patients like crazy because they know that we can kind of be the captain of the ship when it comes to auto accident cases. And we see the patient, we'll refer them out to a neurologist if we have to, an MRI for injections. Sometimes we have to do pain injections and trigger points. And so the attorneys love working with chiropractors, smart ones, I should say, because we know how to steer the ship, so to speak, when it comes to healthcare. And that's a lot of our patients do that. Dr. Joe, I want you to be the guy telling me where to go and what to do. And we do. Now, I'm not a medical doctor. I'm not claiming to be. I'm not against drugs. I'm not against surgery. But I'm against unnecessary use of these treatments. And that's where people, the public, as well as the healthcare community, are getting real excited. I've had several, over the years, I've had 2 or 3 doctors want to come, medical doctors want to come practice with me because they want to learn what I'm doing. And that's quite a compliment. From 30 years ago, they wouldn't even talk to me to say, hey, I want to become your employee, which is kind of cool. Unfortunately, there's still some healthcare providers that bemoan the fact that while drugs pose a serious problem, they're still seen as the only solution. Well, sometimes they are. Absolutely. If you have a thyroid condition, a thyroid disease, you have to remove your thyroid, you have to take thyroid medication. If you have type 1 diabetes, you have to take insulin. It is what it is. Now, we can work with that with diet to reduce the amount that you take, but sometimes you have to do it. If you've got high blood pressure, I want you on your blood pressure medication. And then I want you to try to figure out what we can do to fix it so you don't need the blood pressure medication. Many times it works. Sometimes it doesn't. But I tell my patients this, listen, I want you to do everything I do, everything I tell you to do for whatever. Usually 60 days is the average in my offices. If I'm wrong, so what? I'm wrong. But if I'm right, which I usually am, my team of doctors and I, then we all want to move forward. And then you can decide what direction you want to go in. And essentially 100% of the time, I don't know anyone who doesn't say, wow, I'm getting better with this lifestyle. I don't want to do this anymore. Usually doesn't work. So it doesn't matter who you see. If you see Dr. Dave, Dr. Terry, Dr. Kat, Dr. Irwin, Dr. Gail, myself, everybody's handpicked by me and trained by me. And all the doctors are specialists. So a lot of patients come in and say, I want to see this doctor one day, this doctor another day. Doesn't matter to us. We just want to get you well. So back to this whole point of why holistic healthcare is booming. American Society of Consultant Pharmacists on their website says, while medications are probably the single most important factor in improving the quality of life for older Americans, the nation's seniors are especially at risk from medication-related problems due to physiological changes of aging, higher incidence of multiple chronic diseases and conditions, and greater consumption of prescription and over-the-counter medication. So they're saying that the drugs are important, but there's a downside. And this is the consultant pharmacist website. The same site says seniors 65 to 69 years old take around 14 prescriptions per year. 80 to 85-year-olds take up to 18 prescriptions a year. That's crazy. I don't take 18 supplements a year. I take supplements every day. I certainly take Dr. Joe's Super Greens and Dr. Joe's Essential Source, which, by the way, I think you should be taking too. But I add other supplements because I do a protocol for myself and what I need, and that's why every patient we do a customized plan, but I don't even take that many supplements. Among seniors, medication-related problems cost, ready for this? Here, I'll solve the problem right here. President, Mr. President, make me a Surgeon General. We'll solve the problem. Medication-related problems costs $177.4 billion a year. These are medication-related problems. Adverse drug reactions among the top 5 greatest threats to health to seniors, and 15% to 25% of drugs taken by seniors are unnecessary or inappropriate. So up to 25% of all drugs, 1 in 4, are unnecessary or inappropriate. And that's following the guidelines. One of the biggest things you can do for yourself, whether you're healthy or you're suffering from an illness, is take control of your own health. Because doctors are busy. Doctors have to see more and more patients just to pay their overhead. It's not like the old days where you could spend an hour with a patient and get paid for it. No, you can't do that anymore. So this is why I teach my patients, you got to take control of your own health. In the past years, a lot of people just assumed the doctors were the only ones who had any idea how to treat illness. Now, if a doctor handed them a prescription, they'd fill it, they'd begin taking it, and a lot of times, still to this day, patients come in and I'll say, what medications are you on? They'll list the medications. I'll say, tell me what they're for. And the reason I ask that is some medications are used off-label. And they'll say, I'm not really sure why I'm taking this one, and this one, which blows my mind. If the doctor said they must have surgery or cut out something, they did it. They figured a doctor was the expert. Well, those days I think are over. Because according to my medical doctor friends, we all have the same complaints. Patient compliance, patients not doing what we say. There's a boatload of information out there. Of course, there's the website, my website, drjoeesposito.com. We archive hundreds of hours of radio shows. We videotape my live lectures, all on the website, and the cost for all of that, hundreds of hours, no charge. It's my gift to you. You can also get Dr. Joe's Super Greens and Dr. Joe's Essential Source. Now, there is a charge for that. My books, Eating Right for the Health of It, Prescription for Extreme Health. Easy, simple ways that you can start educating yourself. You can do it in a car. You can do it when you're working out. Do it on your phone. And start listening to my radio shows. The book, I don't have it on tape yet. I haven't read the book on tape yet. But read the books. Read the short. I write my articles really short because I know people have short attention spans. But at least, if you do nothing else, take Dr. Joe's Super Greens and Dr. Joe's Essential Source because that's going to be the minimum amount of nutrients that your body needs to get the day working. Then I would add chiropractic care, of course, because I can't imagine life without chiropractic care because it realigns all the things that we misalign every day in our lives. And then if you have acid reflux, heartburn, burping, gas, bloating, in a lot of cases, not all, but a lot, the stomach is pushed up against the diaphragm, and we need to mechanically pull the stomach down away from the diaphragm so that the stomach relaxes and can start digesting food. There's a healthcare plan for you. But my website is a great source of information 24 hours a day. It's there for you. You want to get good sleep. You want to do the right exercises. You want to eat the right foods. You want to take the right supplements. All of that is on the website, and this means that you now are taking control of your own health. And when patients do it, inevitably, I don't know of any patient that followed our advice and wasn't happy and followed it through to the end. If people are happy with it and millions of people are hitting my website and listening to my shows, maybe there's something to it. Maybe you're missing out on the boat, and chances are you are. And this is one of the reasons why alternative healthcare is so popular. because people are just sick and tired of being sick and tired, and they want results. So again, co-manage the case with other doctors. I'm more than happy to do that. I've had therapists send me patients because I explain a lot in my lectures that the stomach and the brain are closely related. And if you're not digesting your food properly, you can't absorb the nutrients to produce the neurotransmitters to make your brain work. Had a therapist send me a patient a while ago, heavyset fella, and came in with his leg removed. He had a prosthetic leg. And he said, my therapist sent me here because I can't stop eating sugar, and if I don't stop eating sugar, I'm going to die. They already cut my leg off for diabetes. They're talking about cutting the other one off now, too. Good for everyone involved to come to the realization that there's an addiction going on here, and the best way to deal with addiction, any type of addiction, is get healthy. Mentally, but you have to deal with the physical as well. So many times I see people struggling, and it just drives me nuts. I know with churches a lot, they'll say, well, let's pray for Bob. Bob has cancer. Let's raise money for Bob. Let's have a cake sale. What? You're going to sell cake and sugars and breads and cookies and donuts and pastas, the things that actually feed cancer cells, to raise money to help Bob with his cancer treatment? That doesn't make any sense to me. How about we do something healthy for Bob to raise money? I think that's a much better choice. And it is for you too. Making better decisions is going to be the key here. Big F we get on health, on a health report card when it comes to obesity. I used to be fat, but I was fat when I was young, before all the steroids, hormones, chemicals, pesticides, herbicides, genetically modified foods, high fructose corn syrups. Now it's a whole lot harder to lose weight than it was when I was a kid. Obesity-related illness will raise the national health care cost by about $48 billion annually over the next 2 decades. And that's another 7.9 million new cases of diabetes, 5 million cases of chronic heart disease, 400,000 cancer cases, all courtesy of us getting fat. So when it comes to health care as well, instead of all blowing smoke up everybody's skirt saying, oh, we got to change the way the insurance plans and we got to cover everybody, how about we just get people well? How's that for a concept? Hey, I'm a capitalist. If you want to sell a junk food, more power to you. I support that. But also, you need to then give me the right, which you do, you the public, to educate yourself and do the right thing to get well. And so then you can make the decision. If you want to eat yourself to death, it's your choice, man. Knock yourself out. But most people don't. Most people want the information to get well and stay well. So the prediction I just gave you is slightly more dire than the American Journal of Preventive Medicine's projection of 42% of all adults will be obese by the year 2030. How many years is that away, folks? Not many. 13? 13 years from now, half of the Americans in this country will be obese. Not overweight, obese. Now, that's not chump change when we're talking about this kind of money, especially in light of the current struggles to keep Medicaid going, the fact that medical expenses are not covered by health insurances, and that's one of the top, if not the top reason, one of the top reasons why people file bankruptcy. Healthcare costs. They just can't afford to pay their bills. So here we are, keep saying, let's pay the doctors or let's figure out a way to have better insurance. I say, let's do it the other way around. Let's have less people get sick. I like my approach better. And it's a whole lot cheaper, by the way, too. A lot of it has to do with unhealthy processed foods, not getting the right sleep, not getting exercise, not getting enough sunlight, staying away from toxins and poisons. And if you do all that, the chances are you won't have to be sitting in a doctor's office or a hospital, unless it's an unfortunate accident, of course. Now, I say you need 3 things to get well. You have to have a normally functioning nervous system, a normally functioning digestive system, and good nutrition. So as a chiropractor, we look at the nervous system because the nervous system controls everything. Nothing happens unless the nervous system tells it what to do. So if you have a pinched nerve with neck pain or back pain, shoulder pain, headaches, numbness, tingling, muscle weakness, usually, not always, usually it's a pinched nerve. And if you put the bones back in place and take the pressure off the nerves, we usually get some real good results. Now, if you become a patient of ours, don't jump ship too early. Most people get results very quickly. Some people it takes longer. So don't say, well, I went there twice and I still have a headache. How long have you had a headache? 27 years. All right, we're not that good. The guy who did that in one shot, he wore sandals. That was 2,000 years ago. It takes a little bit longer in most cases. So Get the nervous system working, unpinch the nerves, balance out the muscles. If you have acid reflux, heartburn, burping, gas, bloating, pull the stomach down away from the diaphragm, in most cases, not all, to get the stomach to start digesting food properly. Get you on a good diet. Stay away from what I call the 7 deadly sins of nutrition: alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. Does it stink? Yeah. Is it hard to do? Yeah. Is it worth it? Yeah. Trust me, I've seen thousands, tens of thousands of people. And when they follow the advice that we give them, most of them are extremely happy with what we do. And then eat the right foods. You have control over that. And it's so much cheaper to eat right than it is to eat wrong. If you go to my website and sign up for my newsletter, just give me your email address. I'll send you my newsletter, no charge. And I'm also going to send you a link to a lecture that I did called So What Can I Eat? No charge. My gift to you. And it tells you how to go through breakfast, lunches, dinners, snacks, all laid out for you. Real simple, real easy. And that's my gift to you. Supplement-wise, minimum Dr. Joe's Super Greens and Dr. Joe's Essential Source. Those are on my website. They're also on Amazon. If you have an Amazon account, you can go there and get them. And that's the minimum amount of nutrients to take every day. They're 2 powders. I mix it with coconut milk or almond milk because I don't do cow's milk. And I drink it at least once a day. I can't think of a day that's gone by that I didn't have it. So those are on my website. Very inexpensive investment in your health. And do it for a month. See what happens. I don't know of anyone who wasn't thrilled after taking it for a month. So you might be the first one, but that usually doesn't happen. So that's the plan. Normally functioning nervous system, normally functioning digestive system, and good diet that I feel is the basis around complementary alternative healthcare and why it's booming so much. Now, folks, if you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge. Go to my website, drjoeesposito.com, or you just Google Dr. Joe with the number 1 Dr. Joe in the world, and you can book an appointment right online. If you want to order the Super Greens, the Essential Source, my books, read the articles, that's all on the website as well. But if you're serious about wanting to get well, if you're just sick and tired of being sick and tired, go to the website, book it right now online or call us. We accept people with all insurances, no insurance, car accidents, sports injuries, workers' comp, children. I really don't stress this enough. Children need chiropractic care because if they're straight, they grow straight. If they're crooked, they grow crooked. So if the spine is lined up properly, the body can grow properly. If it's not, it won't. Just like athletes. I tell athletes, I want you to get chiropractic care so you build up strong muscles around straight bones, not strong muscles around crooked bones. So website's a great source of information and a way to get in touch with us for our offices in Marietta, Duluth, and Stockbridge. drjoeesposito.com or just Google Dr. Joe. So even if we have a healthy economy, it's a good idea to follow these health guidelines, as all the money in the world is not going to protect you from disease if you fail to follow a healthy lifestyle. And you're seeing more and more and more people get well. And I told this story the other day. I was a guest on one of my colleagues' shows, and I don't think I ever told this story on my show. Years ago, somebody who worked for the government came to me and said, listen, we need you to put together a healthcare, a diet plan for President Bill Clinton. And I said, okay. So I did. And I never heard anything back again, never heard any follow-up or anything. However, Bill Clinton did become a vegetarian, or vegan actually, and after he had his heart condition, lost a ton of weight, recovered from his heart condition, and I often wonder if that was my plan that was presented to him that he followed, because the government could never tell me that, I did it or not. So you're seeing more and more people going to a plant-based diet. You're seeing more and more people going to chiropractic care. It's extremely popular. Things like Dr. Joe's Super Greens and Dr. Joe's Essential Source, booming in popularity. Why? Why would you spend $1 on something if it wasn't working? And it is working. And that's what's so cool about it. Oh, by the way, I got to throw this out there too. Follow me on Facebook. Go to Facebook/Dr. Joe Esposito. Follow me on Instagram. We send out a lot of good information there. Sometimes I'm going to do a surprise guest appearance on somebody else's show, TV, radio, lectures. We send all that out on there, and you can follow us there as well. And if you have questions, you could send them to me through the website, drjoeesposito.com, and I'll try to answer anything the best I possibly can. So we're talking today about why alternative healthcare is just booming. And kind of related, this is kind of interesting too. A recent study found that the taste buds of obese children are less sensitive than normal weight children. German researchers administered taste tests to 99 obese children, adolescents, and 94 normal weight children. Each one tasted 20 strips of paper treated with 4 varying concentrations of sweet, sour, salty, bitter, and what's called umami, which is a savory flavor. A perfect score of 20 meant they identified all of them correctly. The scores range from 2 to 19. The obese children averaged a score of 12, or 12.6, compared to the average score of 14 with normal weight children. So overweight children, we found, actually don't taste food as well. And so what do? You want to eat more. And one of the things I find that people don't taste well is because they have sinus problems. How many people have sinus problems? Raise your hands. A lot of you. And so we can give you medication to clear up the sinuses. However, there are side effects. The number one cause of sinus problems I find is dairy products. The number two is wheat. So why don't you do this? Give up your wheat and your dairy 2 weeks, 10 days, whatever you want to do, 10 days. So I'll make it easy for you. And on the 11th day, I want you to have a big couple of slices of pizza, which is cheese, dairy, and wheat, the crust. And notice if your sinuses start running. Notice how you feel. You're tired, gassy, bloated, constipated. And you'll realize that wheat and dairy are not the foods you want to put in your body. The other thing that can cause sinus problems, which can prevent you from tasting very well, is acid reflux. The acid can come up into your esophagus from your stomach, irritate your throat, which can cause a lot of coughing and clearing of the throat, but that can also go up into the sinuses, causing the sinuses to inflame, and if your sinuses are clogged up, you can't taste food as well. If you can't taste it as well, chances are you're going to eat more. And that's why I find a lot of patients, when we fix their digestive system by gently pulling the stomach away from the diaphragm and getting them off the bad foods, they start to lose weight because they're eating less food. So that's another twist that we might have when it comes to weight loss. And your body doesn't need a lot of food. It needs a lot of nutrition. And that's why Dr. Joe's Super Greens and Dr. Joe's Essential Source are so perfect. It's a super high concentrated of fruits, vegetables, prebiotics, probiotics, digestive enzymes, omega-3 fatty acids, great source of iodine. And when your body gets these nutrients, it's not as hungry. And then you can eat less food. Because remember, when you're hungry, you're not hungry for food, you're hungry for nutrition. And when you give your body the nutrition, everything works better. Whether it's your brain function, your bowel function, your romantic function, all of it works better when you have a normally functioning nervous system, a normally functioning digestive system, and good nutrition. So it's not hard to figure out how to solve the healthcare crisis. In fact, it's really easy. Get to the cause of the problem. If someone has pain, find out, is it a pinched nerve? In a major majority of cases, the answer is yes. Put the bones back in place. As a chiropractor, that's what me and my team of doctors do. If you're having acid reflux, heartburn, burping, gas, bloating, let's see if we can massage the stomach away from the diaphragm. In fact, if you go to my website, drjoeesposito.com, the number one article that's downloaded by far is the one on gastroesophageal reflux disease, GERD. And if you read that article, it's 3 paragraphs, real simple. It'll explain to you the techniques that we do for those patients. Is it going to help everyone all the time? No. Does it help most of the people most of the time? Yes. And then you could order the supplements, the Super Greens, the Essential Source. If your bowels are not moving 2 to 3 times a day, I have something called Dr. Joe's Intestinal Cleanser. And there I recommend you take that until the bowels start moving normally again. But read up on chiropractic as well, because when to me, it's the only thing that makes sense, and it's the missing link in healthcare. I shouldn't say the only thing that makes sense, but it's the missing link in healthcare. And when we start incorporating these things into your daily routines, you see the changes. And then you take control of your life. Eat more fruits and vegetables, nuts and seeds. Have a salad every day. Pick the choice on the menu at the restaurant that doesn't have the animal proteins in it, that has the plant-based nutrients in it. Eat less. Skip dinner every now and then. Drink more water. And when you start doing these things, I promise you, you're going to be happy. And if I'm wrong, so what? I'm wrong. So you started eating right for a couple of weeks. But if I'm right, which I am, I want you to consider this lifestyle for you, your friends, and your family for the rest of your life. And folks, if you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge. We would love the opportunity to be your doctors. Go to my website, drjoeesposito.com, or just Google Dr. Joe, number one Dr. Joe in the world, and we will set you up a time. You can do it online if you want, or you can call us, and we'll set you up a time to come in. We accept patients with all insurance. All insurance policies. If you don't have insurance, Medicare, car accidents, sports injuries, we want the opportunity to help you get well and stay well. If you're not ready to make some changes in your life, I beg you, don't come into my office. when you're ready, when you're serious, when you're sick and tired of being sick and tired, the website is there, drjoeesposito.com, or Google Dr. Joe. You can send me questions through the website as well. I will do what we can to help you get well and stay well. Hey, listen, if I don't say it enough, thank you so much for listening. Tell your friends about the show. We'll catch you next time.